I think some of the barriers when people want to access care, any care really, is that they've got to go through like a gatekeeper. And the truth
Yeah,
of the matter is, I think that psychologically kind of puts people in a black hole of, you know, what if I don't get past this gatekeeper, even if they've had multiple diagnoses. I think
yeah.
we get kind of diagnosis out sometimes. So I think that's definitely a barrier that's been lifted when certainly when accessing your level of care.
Yeah, no, definitely. As I said, we try to make the journey as painless as possible, as smooth as possible. We 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 work with person choice, so we work. It's a patient choice at the end of the day. And I do perform the surgery occasionally on cis women, and I don't ask cis women to go and get me a referral letter. So I wouldn't do that for trans women either.
That's an interesting concept. To hear people going for breast augmentation who are being asked for referral letters, like they say, would you ask any other woman for a referral letter? And again,
Yeah,
that barrier to care, isn't it?
yeah.
So the less invasive it is, obviously, the better. And I don't think there's any suggestion or any evidence to suggest that not having a referral letter leads to more regret. I just don't think that that would be there. So, what is what?
N- Not definitely nothing I'm aware of. And in terms of voice surgery, like gender affirming voice surgery, regret is extremely small. Like I've never come across any patient who told me that they regretted the surgery. So I'm sure it will happen at some point, and some people, because there is a side effects, there is a trade-offs in terms of voice. So you gain pitch, but you lose some other aspect. So I'm sure somebody will find that too much for what they require their voice for in day-to-day life. But in general, the patient satisfaction, and we see that on patient-reported outcome measures, because we use like a validated questionnaire, and we see significant improvement in voice-related quality of life after the surgery.
That I mean, the truth of the matter is, having worked at Gender GP as long as I did, um, never did. We used to do follow-ups, and never did we get a negative follow-up. Not everybody's life's perfect, and we know that being trans, certainly in this current climate,
Yeah.
is really challenging. We never saw a less than positive response to care.